Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common question I get from patients is, what is the difference between a chiropractor and a physical therapist? And when would I use a chiropractor and when should I see a physical therapist? So a chiropractor is going to be trained in more acute painful conditions related to the spine. That could be the neck, the mid-back, or lower back. We're also trained in treating disc injuries, both to the neck and lower back. And we're also trained in treating extremity conditions as well. Chiropractors have a wide scope, meaning that we can diagnose conditions and refer to other physicians as needed. We're also considered portal of entry doctors, meaning that you do not need a referral in order to see us. We're going to be able to diagnose you and determine what is the appropriate care that you need. A physical therapist is going to be trained more in rehabilitation techniques for both chronic and post-surgical cases. So a lot of times a physical therapist will get referred to by an orthopedist to rehab, say, a total knee replacement or a hip replacement. They're good at rehabbing those injuries to help strengthen the muscles around the injury and to help prevent any future injuries. So in my office, we see a lot of acute painful conditions. And a lot of times what we do is we provide quick pain relief for the patient, get them out of pain, get them feeling better, help to stabilize their condition. In some cases, we just give them at-home exercises that they can do. In some cases, we refer to a physical therapist. If I think they need in-office rehabilitation, I will refer to a physical therapist to do that one-on-one monitoring to make sure that they do the exercises correctly and to help prevent future injury. So if you're dealing with an acute injury to the neck, the back, any kind of disc injury, I would suggest seeing a chiropractor first. They're going to be able to diagnose you correctly and to figure out how to provide pain relief for you for that condition. A physical therapist is going to be able to work with you one-on-one, doing those exercises at the office to make sure your form is correct. The other type of person that would benefit from seeing a physical therapist is if obviously you've had some kind of surgical procedure, whether it be a total knee replacement or hip replacement or any kind of shoulder rehab. They're going to be appropriate at helping you rehab that injury so that injury can be strong and prevent any future injuries. I do see the future of chiropractors and physical therapists being very similar. A lot of chiropractors are taking rehabilitation courses to learn how to rehab those patients once we get them out of acute pain. And likewise, a lot of physical therapists are taking courses to learn how to treat acute patients, such as with dry needling or manipulation, manual therapy techniques. So I do see the blend of the two professions down the road, and there's going to be a very similar skill progression as we go forward there. But I hope that answers a common question of what is the difference between a physical therapist and a chiropractor and when you should see both. If you have any questions, reach out to me at 703-912-7822, or you can schedule online at novachirowellness.com.